Welcome to the PUTTcast podcast by Pharmacists United for Truth and Transparency. Pharmacists United for Truth and Transparency is the only registered 501c3 nonprofit wholly dedicated to exposing the hard truths about pharmacy benefit managers and how their greed-centered, profit-at-any-cost business practices are driving up drug prices and healthcare premiums while reducing consumer choice and endangering patient access. To learn more, visit our website at truthrx.org.
Welcome to this episode of the PUTTcast. I am your host, Lauren Young. I'm also the Vice President of PUTT, and I am a second-generation pharmacy owner from the great state of Illinois. I'm joined by our PUTT Executive Director, Monique Whitney, and we have a fabulous group of individuals that really have been fighting for PBM reform. We're so excited to introduce Congressman Jake Auchincloss and APCI's Greg Reybold. So welcome to the PUTTcast, gentlemen. Hopefully we'll have a great conversation. I know there's been a lot of positive support for HR 9096 so far in my world, and a lot of the other pharmacy owners that are excited about having something that comes out swinging against PBMs. So welcome to the show.
Lauren, thanks for having me on. And there's a lot of excitement in my world too. We just got to turn that excitement into co-sponsorships and then turn it into law.
Well, I know there's two Illinois Congress people that have signed on as co-sponsors. We have Congressman Raja from the northern part of Illinois, and then my own Congresswoman Nikki Budzinski has signed on as well. So I'm very happy to announce that. We have a list of others as well, and I know that owners across the country are working to get their own Congress people on in support of this as well.
My goal is 25 Democrats, 25 Republicans by Thanksgiving on this bill. We're not there yet. We're probably only a third of the way there. And so for anybody listening, please call up your member of Congress. If you go to a League of Women Voters website, they'll tell you if you type in your address, either of your pharmacy or of your home, who the member of Congress is. And then you can go to their website, send an email, but even better, call and request to speak to the legislative director. I'm telling you, these messages matter. Every single week, I'm talking to my staff. I want to know who's calling and about what. Members of Congress live and die by constituent opinion. And when there is sustained, organized outreach, it absolutely matters. And while you're doing that back home in the district, I'll be talking to these members on the House floor, and we'll have a pincer movement. We'll get these 25 and 25.
Well, we are very, very excited. I think that's a goal that we are energetic and trying to get behind and get all of our other owners and members, like you said, talking to their legislators. I know it can be a little daunting as an owner because you think, am I just not doing something right? What am I doing wrong here? This should be pretty black and white. We buy a medication for a patient, we bill their insurance, and then we get paid by that insurance. But unfortunately, that's not really what's always happening so far. So this bill really helps bring transparency to this whole process. And I think that's what owners are most excited about, that there's actually people in Congress that are listening to people who have put their blood, sweat, and tears into opening a small business and serving their communities. So I think that's what HR 9096 really brings to the table.
Agreed. And it's not just transparency, as you well know, it's legally binding restrictions on some of the worst price gouging, self-dealing abuses by the big three pharmacy benefit managers. 7 out of 10 Americans who are on a commercial or a Medicare plan are working with a insurance company that also owns the PBM and the pharmacy through which they are being dispensed and the drugs and through which the formulary management is made. That is classic vertical integration. So not just the pharmacist, but the patient as well is really subject to some of the biggest corporations in the history of the world. I mean, these big three PBMs and their insurance overlords are all Fortune 20 companies, and they have nested themselves in the middle of a complicated drug pricing supply chain. They have obscured themselves from public view, and they've gotten comfy and they've gotten greedy. And now Congress is paying attention, and we're going to fight back on behalf of independent pharmacists. These independent pharmacists, for everyone who is listening, I want you to know your voice, because you are not just a medical provider, you are also a small business owner, and you also are an individual who helps knit together your downtown. So many of our downtowns have become less walkable, less cohesive because of bankruptcies of small businesses, in particular local pharmacies that are big draws for people to come around and engage in other retail activities. So you've got a lot of heft, local, state, federal. Use it and fight back against these corporate abuses.
Go ahead, Greg.
Oh, I was going to say, Congressman Auchincloss's point, we've seen several examples. We're about 16 co-sponsors, and we've seen several examples where sort of some of the staff was walls up with pharmacists and sort of, oh boy, we don't know, there's not likely going to be a co-sponsorship. And when the pharmacist took the time and the representative took the time to have a meeting, we've seen several of those convert really, really quickly, right? At least 3 where it sounded like it was probably going in almost like hey, we're sympathetic, but in terms of co-sponsoring, not likely, to them sponsoring within the day. And I think, that's it may not, it may sound daunting, or to some, it may not sound exciting to, do that grassroots, have that meeting, but boy, does it make a difference. And it is that pharmacists being willing to take that step has resulted in at least 3 co-sponsors. I mean, I think all the co-sponsors were a result of outreach, but those are like 3 really specific examples where they were basically told by staff, not likely. And when they heard the story and the experiences that pharmacists shared, that made a difference, and they are now on that bill. It's not always as easy. I'm going to brag on Lauren. I think Lauren was the record. She was like, okay, I'm going to reach out. And then literally, I think like 3.5 minutes later, she's like, good news. I'm like, what? I've never seen something happen that fast.
Well, Nikki's a great member, and Greg, what you're saying is really true. And I just want to formalize this a little bit in the minds of our listeners too. There's hundreds of bills on any given day floating around Congress. There's 435 members of the House, 100 members of the Senate, thousands of staffers, tons of people with good ideas, lots of white papers and think tanks. And so a lot of times it's just, people just don't know that this exists.
That's right. Yeah.
But if I have a constituent who says, Jake, I want to come talk to you about this bill, at the very least, now my ledge staff is doing a recommendation on this bill. We are reading the summary of this bill. I'm asking questions of my ledge staff. I'm figuring out who else is on it. And I'm getting more aware of the issue. And now I feel as a member that I owe this constituent a response one way or the other. And guys, guess what? Politicians like to tell their constituents yes when people ask for things. And so it really is a forcing function, to put this issue on the docket. This is an esoteric issue. It's not one that is unfortunately as salient or as urgent as it should be in Congress right now. And so we are really just giving this bill and this issue a chance to be discussed. Because then when it's discussed, people are like, wait a minute. The PBMs are doing what now? Like, they're taking $300 billion out of the healthcare system, and they are steering business to their own pharmacies, and they're marking up leukemia drugs more than 5,000%, and they're underpaying pharmacists below NADAC, and they're actually manipulating the NADAC marketplace. Like, yeah, we got to fix this. But that conversation has to start for this change to happen.
And Congressman, you are not a pharmacist by trade. So
No.
you coming on board and really taking the reins in this is so important, because I know whenever we work with legislators, they do get, they want to be subject matter experts on this because they know it impacts so many of their constituents. They're interested in using us as a resource so we can help them better understand the multitude of different egregious actions that PBMs are utilizing to harm patients. So what was it that really tipped you into saying, okay, this is not just an anomaly that's happening in Massachusetts. This is something we need to do?
Oh, absolutely. So first of all, I grew up in a family of medical scientists, people who developed, did a lot of basic research. I should say, and my mom is the head of the Dana-Farber Cancer Institute and has really made curing cancer the focus of her entire career. My dad is at the National Institutes of Health. I represent in the suburbs of Boston a lot of constituents who do a lot of work in biotechnology. And so I came to this in my first year in office in 2021. We were discussing a lot about drug pricing policy as part of what ultimately became the Inflation Reduction Act, which empowered Medicare to negotiate drug prices. And that money then went towards clean energy investments. And as part of that process, I just kind of dug more into the drug pricing supply chain, because I really see it as a Venn diagram where you want innovation, you want access and affordability, and you also want the jobs and economic development, particularly in Massachusetts, that comes from a healthy biopharma system. And as I was doing that, you kind of come across, it's like you're orbiting this black hole and you're like, wait, everything like this, like the ship that I'm steering keeps on bending off in this weird direction. What's happening over here? And that black hole turns out to be pharmacy benefit managers. You mentioned, Lauren, how complicated this is and the urge to become a subject matter expert. This is a very important part of this domain area. I think you have to study it well enough to gain some essential insights and some intuition about how things work. And I think I've been able to do that, but then also be able to say, I can't get lost in all of the sort of different permutations of how PBMs manipulate it, because they're experts at doing that. They will always find the next loophole. And folks like Greg are going to always be there to fight them off. I think my job is to take that essential insight, to draft a comprehensive bill, and then to do the political legwork of getting it across the finish line.
We are thrilled to have you as the captain of this ship, because that's really important. And I know that, again, there's co-sponsors on this bill already. You have a goal of 50 by Thanksgiving. And I like the bipartisan outreach so far. I think that's important.
Critical. And, Greg, I know you've worked on this issue on both sides of the aisle. Can you talk a little bit about how those meetings are the same and how they're different maybe on either side?
Yeah. And I think when you look across the country, particularly at the state level, where there's just been more substantive PBM action, right? This is by far, and for context, Pharmacists Fight Back Act is the most comprehensive piece of PBM reform that's ever been introduced at the federal level. And it's not close, right? But what we have seen at state levels is real attempts in very Republican strongholds and very Democrat strongholds to rein in sort of the worst practices of pharmacy benefits managers. And so it is, from our perspective, a very, very bipartisan issue. Now, there's different things may speak to folks differently a little bit, right? But what we've seen is this is an issue that resonates very much across party lines.
The thing that we have to be on guard for is the efficacy and persistence with which the insurance companies will claim that they have to raise premiums. This comes up, and Monique and Lauren, I know that you see this constantly, as I do, as a scaremongering tactic. Every time we try to do regulation on drug pricing, on hospital pricing potentially, on copays, on deductibles, the health plans come back and they say, well, premiums are going to go up. And it really rattles policymakers because premium inflation is deeply unpopular. And we got to build a coalition that can deflate that threat and point to the fact that organizations like United Health Group, Fortune 5 company, made something like $7 billion in profit last quarter. And yet they are claiming that, they're going to have to penny pinch so badly that they're going to raise premiums on everyday Americans because we're trying to make sure that, NADAC reporting is sound, or we're trying to make sure that copays reflect the actual acquisition cost of drugs and not some price gouged made up number.
Yeah, and if I could speak to that, boy, I think you center punch it, right? As the sun rises, the insurance companies and the PBMs will say, "Oh my God, premiums!" Right? And it is very much fear mongering. What we found is, in the political realm, they can say almost anything, and oftentimes, there are folks that will. And so when we passed, I think, a big steering bill in Georgia. There were literally, I wish I could share it on a screen right now, but there were like memes going around from the PBM interest and insurance interest that said it was going to increase costs by $8 billion, right? $8 billion. But what we found, if you're sort of deliberative when you go back and look, again, they can say anything. But when they go to file year after year, their premium increases at the state level, those have to be signed off on by actuaries, right? Yeah, and those aren't political hyperbole. And what you often see is indeed, there were no premium increases, or if there were premium increases, they were very much in line with the premium increases year over year over year, where there was no action taken, right? And so it's sort of fox guarding the hen house, right? When the insurance companies are saying, beware of higher premiums, I think you've got to view that with some skepticism. But when you dig into insurance filings, so often what you see is, the year that they did pass steering, right? If you look at the growth trend, it's really, really consistent. And they also sometimes will drill down into, hey, what's the growth spend for the pharmacy section? And what you see is, indeed, this legislation doesn't have impact. And then in certain ways, some of the legislation can very much decrease costs. So
that's a great point, Greg. We got to do more of that. Look at their filings at the state level, and also look at discovery and litigation, where also they are really subject to be truthful, and point out that actually this is not the driver behind premium inflation. And I think that's going to be an important way to build support for this bill. Part of this bill, one of the policy items here is, for example, preventing the PBMs from building exclusive networks. And they're pushing back really hard on that. They're saying that if we can't create skinny networks or steer towards our own pharmacies, then that's going to preclude any leverage that we have over the pharmacists. And I just, it's a flimsy assertion, but it's one that they're going to hook into.
Mm-hmm.
And the narrative takes because they've been using it for years and years and years, right? And so folks' offices are used to hearing that narrative that, hey, these are cost-saving solutions, right? And this vertical integration increases efficiencies, and we're offering these cost savings. And because they can manipulate price, for the uninitiated, sometimes it can maybe look like there's cost savings, right? Because maybe they'll say, hey, 0 copay if you use this vertically integrated pharmacy. But as folks dig in the data, it gets to the point where it's almost an unsustainable argument. Because again, like the MedPAC report in 2023 found that, vertically integrated plans are much more likely to reimburse their pharmacies higher. Mm-hmm. Then you dig into, the work of 3-Axis, and the more data you look at,
the FTC and
FTC,
OGR,
that's right.
Mm-hmm.
I think the other challenge we have is that, pharmacy is parallel to the hospitals, and the plans actually do, in my opinion, have a good argument about skinny networks when it comes to hospital providers and the necessity of those, at least the leverage to create skinny networks and negotiating with hospitals when it comes to those plans. And then they take that same, I think, relatively sound argument, got to be able to say no to big hospital systems or else they're going to inflate the prices, and they drop it onto the pharmacy system, where it is a totally different set of incentives, but it rhymes to, I think, too many.
Absolutely. And I think that is where the legislators really have to get to know some of these issues and kind of separate that a little bit, like you said, because I know that there's a lot of people coming to the Hill and speaking either on behalf of the insurance companies or behalf of some of those other interests that really need to remember that a lack of patient access is what got us here. Patients are being harmed by not being able to get the right medication at the right time at their preferred, trusted place of business. And so I think that's really what this Pharmacists Fight Back Act really allows them to do, because in no other business sector would it be okay for you to say, okay, we're going to let your competition set all the rates, and there is no negotiating, there is no anything that you can do to make sure that you can be a competitive factor in this business. And by the way, you also have to make sure you are taking care of your patients that are coming in the door. And so that's really where the pharmacists are at. So I think that's why this reimbursement logic being built in is so important, because we can't dispense a medication that we know we're not going to be able to replace for the next patient. And how do we choose between Miss Smith and Mr. Jones as to which patient is more valuable to get that medication?
I think that part is critical. And so many of the pharmacists that I talk to, they want to be medical providers. They want to be able to offer sound, timely, and empathetic advice. Mm-hmm. They don't want to be harried by prior authorization and other PBM abuses. And they don't want to be price gouged such that, as you said, Lauren, they're making these really challenging trade-offs between being a medical provider and being a small business owner. We need them to be both, and they're creating a lot of value for their communities in so doing. We're unfortunately now seeing that being undercut even by another avenue of attack, which is this NADAC market manipulation, which I don't know if anybody has any bets on who's doing it. I know that there's some discussion amongst folks. I have a sense in my head of the 3-letter major player that might be behind it, but I can't throw any aspersions out there. Greg, do you have any bets?
I don't, but I'll say it's certainly interesting, and it's been an interesting year for NADAC, and one of the things that I do think is worth pointing out in your bill is ultimately it's going to bring stability to NADAC, because
right.
it's going to remove the ability to manipulate, and everybody's going to report it. So NADAC
everybody reports,
robust, consistent.
Everybody every month,
Mm-hmm.
no shenanigans. And none of this 1 month, not the other month, have the price spike, and then go point to the price spiking and say, oh, we can't trust NADAC. I mean, it's just sort of sinister 4D chess here. And as you said, Greg, the bill will prevent all of that.
And I love the fact that, we've worked with Greg in Georgia and many other states across the country in getting PBM reform on the state level. So there's always been a cry for the federal government to help us in a lot of the plans that we take care of those patients, but we're unable to help them based on the state rules. So you guys are really looking at making sure that the abuses that are happening in the Medicaid managed care space and, with the federal employees and with TRICARE, those are all things that will be able to be positively impacted by the Pharmacists Fight Back Act. That's really what we're looking for.
That's right. I mean, the federal government has massive leverage here through the FEHB, as you said, but also through, of course, Medicare and Medicaid. And I think, Greg, this bill strikes the right balance between using that big stick of the federal government to drive significant structural changes, but also providing some state elasticity around that fair dispensing fee. So we've got, the NADAC plus 2% plus fair dispensing fee, and we're saying that can be massaged at the state level with feedback from pharmacists and market conditions.
Yeah, I think that's absolutely right. And, for context, the federal government is the biggest payer in the country, right? If you just look at federal employee health benefit program alone, that's the biggest self-funded plan in the nation. And that's just that. Then you throw in Medicare Part D, Medicare Advantage, TRICARE, massive payer, and Medicaid managed care. And, these pharmacy benefit managers are either contractors or subcontractors with the federal government. And they have leveraged that position to, basically to back up a truck of money, billions of dollars, right, of government dollars into their coffers. And at the same time, what they have done is they've essentially rigged the market. Government contractors are the ones that are engaging in price fixing, right? They're the ones creating an anti-competitive, non-free market environment. And this bill goes a long way to stop that, right? And take a reasonable approach, but it cuts through all the gobbledygook and it says, hey, you're not going to be manipulating prices, you're not going to be steering patients, and you're not going to be leveraging vertical integration. It will help pharmacy. But I think one of the things that I'm most encouraged about is the outreach that I've been hearing from patient groups, because the patients have been massively manipulated by large pharmacy benefit managers in these government programs, and America's seniors in Part D, I think, first among them. So, this is a bill that's not only going to cut out these games, but it will save patients money at the counter.
So I have a question about, as I know we're coming into the last bit of our time with you, Congressman, with the work that you've done, and you've done a lot of really impressive, taken a lot of impressive ground with this bill. What do you see as the appetite in Congress for continuing this fight? Because a fear that we all have as patients, as pharmacy owners, as medical providers, is that there's going to be something like, oh, well, we took care of it, boom, it's done. When the reality is it's taken, a lot of years to get here. We see it's going to take a lot of years to get the system turned around. Do you think there's an understanding of that on the Hill?
I'm concerned, and I think, Monique, you put in exactly the right point on it, which is there's appetite to do PBM reform. I think basically you can bake in that there's something that we got to do on PBM reform. My concern is that we do transparency and nothing else. That there's some sort of like hand wavy, not bad. It's good stuff, but really not hard hitting enough. And we miss the opportunity, and then focus shifts to, site neutrality for hospitals or some other element of the healthcare system to try to build bipartisan support on. We have got to seize this moment. And that is why I have this sort of sense of urgency about let's get 25 and 25 by Thanksgiving. And then that starts to speak up to committee leadership and to House and Senate leadership when it comes time for PBM negotiations. Those could happen. Those negotiations could happen in December and only in Congress. They, of course, could happen also next Congress, depending on the composition after the elections. But I think we're looking at this next year to 18 months, something should happen. And I want Pharmacists Fight Back to have the kind of bipartisan heft that puts it at the center of the agenda.
And I think 25 and 25 will do that. Now, that said, I thought we had till the end of November. Can we have those few extra days, or is it a hard stop on Thanksgiving?
I want to
late Thanksgiving this year.
But you know what, Greg? I think we can do it. I mean, we got outreach from a pharmacist in Florida who's telling us that he has never reached out to any politician on any issue ever. He watched 4 hours of that House oversight hearing and wants to now lobby for this bill. We did a great event, Greg, as you know, in Massachusetts with pharmacists. We had one say afterwards, this event makes me feel like I'm not going to sell my pharmacy immediately. I want to hold on, see if we can make this work because of this legislation. So where you get that kind of organized, concentrated advocacy and momentum, people pay attention, people listen.
Absolutely.
And I would say, it's a skit, right? I mean, it's delivering this stuff. It is nuanced, right? It can be esoteric, and delivering this stuff is not easy, and particularly not easy if you're an attorney who's in the industry, right? I can talk all day about it and not succinctly and eyes glaze over. But one of the things that I was excited about is, like, you had a tweet the day of that hearing, or maybe it was the day after, and you had like upwards of 7 million views and something like 30,000 shares when you were, sort of grilling one of those execs about the prices of their drugs. But when folks hear it and it's delivered the right way, some people can deliver it, congressmen like you, and some people, can't, right? But when it's delivered the right way, I mean, my God, the message resonates, right? I mean, it was palpable.
Pharmacy famous.
Yeah.
Oh, yes. That was going around in pharmacy circles and people were excited. It's been a rough year with the DIR apocalypse in pharmacies where, that happened the first half of the year, and then, getting those Google alerts about different pharmacies closing. And so I think this has really been the kind of wind in our sails that we need, that someone on the federal level has really taken to heart what our passion is and is willing to fight for patients with us. And so, Congressman, thank you so much for stepping out and really seeing us and leading the PBM reform charge in DC. That's so needed and vital. And we're very appreciative of your efforts. And we're definitely in your corner to help push the message and bring on the 50 till Thanksgiving. That's our goal.
Wonderful. Thanks so much for having me on. I enjoyed the conversation.
Yes. Thank you.
Take care.
Thank you.
Thank you.
Thank you for joining us for this episode of the PUTTcast. If you don't know us, we are from Pharmacists United for Truth and Transparency, or PUTT, and you can join us at truthrx.org, and you can get a multitude of different resources. You can sign up for our newsletters. You can follow us on social media. You can really get a wealth of information from all of our outlets. You can also donate to our cause at truthrx.org/donate. We appreciate your time today, and hopefully you'll join us for the next episode of the podcast.